Ladies and gentlemen, dear colleagues and friends, let me start the CUPID Annual Conference with warm welcome. I'm in the position of CUPID MC Vice Chair, and I am very glad to have all of you on this meeting or annual conference, which we plan for today. Let me first to say a few words about CUPID project, and after that I will tell you some technicalities. And all of you already got the agenda, and we will go through the agenda in the next 1 hour or maximum 1 hour and a half. There is a poor understanding of cancer prevention among people with intellectual disabilities. With CUPID project, we want to establish a research agenda and knowledge base to improve this in the European Union and beyond. Among the European intellectual disabilities population, many cancer diagnoses are symptomatic presentations following on from behavioral distress or physical changes. Cancer deaths among this population occur up to 20 years earlier than the general population, factors influencing unequal health status and premature death amongst the people with intellectual disabilities. Warrant further investigation. The Council of Europe Disability Strategy 2017-2023 recognized health systems' failure to engage with and include people with disabilities. Many external and internal factors influence healthcare engagement among this population, resulting in long-term health consequences. External factors include diagnostic overshadowing, paternalism, and cancer screening delays during the COVID-19 pandemic. For the person, challenges with communication, cognitive ability, and decision-making capacity influence healthcare engagement. It is timely to develop collaborative links with the EU research and service provider communities to reach consensus on addressing these challenges. CUPID establishes active working partnership with academics, researchers, non-governmental organizations, carriers, people with intellectual disabilities, and policymakers as well. Also, CUPID will establish a research agenda and exchange information regarding cancer prevention in the intellectual disability population. Short-term scientific exchanges, training schools, conferences, and seminars using a hybrid approach will explore highlighted issues. Other network funding streams will not support this kind of activity. There are a lot of objectives, and I will read a few of them. Creation of sustainable network of research involved in intellectual disabilities, cancer prevention, epidemiology, health sciences, social sciences, education, and other adjacent fields, engaged in knowledge exchange. Establish the state of art in terms of national and cross-national co-produced knowledge base and explore how this could be on benefit in the lives of people with intellectual disabilities. Development of research agenda exploring where the current challenges lie and what targeted research projects and initiatives would be of most benefit to tackle them while being responsive to the unique needs of people with intellectual disabilities. Then to promote new collaborative funding applications from network members, including national and EU funding opportunities in the area of cancer prevention strategies. To foster collaboration between diverse networks of researchers, including core researchers from the intellectual disabilities community that will build capacity to develop joint research initiatives. We plan to give all of you what we have done in the last year, in the first year of the project. Now we are entering in the second. So that was for my introduction. Now a few technicalities. I would like to ask all of presenters For whole time, from the beginning to the end of the conference. So also,
sorry, Vladimir,
yeah.
you seem to have frozen there for a moment in time. So could you maybe repeat what you said?
Yeah, probably is the internet. I said the technicalities. I don't know what you have heard about the technicalities, that the people should turn off all their microphones. There is a great interest in this moment. We have joined around more than 80 people, which is good number of participants. I asked the people to put their question in the chat if they have, and to write the name of the presenter for which they want to ask some question. They can ask during the presentations, and also we are planning at the end the discussion. All of you already get the agenda, and now I will not read the whole agenda, but I will ask one by one the working groups. This project consists of 4 working groups, and we will start with the results and outcomes of working group 1, where the leaders are Dr. Oliwia Kowalczyk and Dr. Margaret Denny, and both of them will present their results and their activities during the first year of the project. Thank you very much for your attention for the beginning. I will moderate the whole conference, and we will see after each presentation. Oliwia, please start your presentation.
Yes, please just let me upload it.
I think that you have a right to upload to share the presentation. You or Margaret should share. I don't have your presentation, so please share it during she is preparing. Okay, we can see. Just please put your full screen on it, and everything will be okay.
Okay, can you see it now?
Full screen, Oliwia. Full screen.
I have the full screen, but let me...
No, presenter view.
Appears that Oliwia might be sharing the incorrect window on her computer. We're only seeing the window for the PowerPoint application and not the...
Yeah, I can see it. I'm working on 2 devices right now because
okay.
Yeah.
You might need
Margaret,
to stop your share and start your share again with the presenter view, if that's okay. Thanks, Oliwia.
Margaret, would it be better if you share it, please?
Mode.
So I don't keep everyone waiting.
Okay.
Sorry for this inconvenience.
Okay. Can everybody see that? Yeah. Okay, good afternoon and welcome to the conference and to our presentation in Working Group 1. Dr. Oliwia Kowalczyk and I would like to thank Professor John Wells, the chair of the CUPID Cost Action Project, for his inspiration and support for this project. We would also like to commend Professor Vladimir Trajkovski, Management Committee and Vice Chair of the CUPID Cost Action Project, for his excellent organisation of this online webinar. We extend our heartfelt gratitude to all the participants who graced this event with their presence. We trust that the conference will prove fruitful and enjoyable, and we hope that it will be a valuable experience for all. In Working Group 1, the presentation provides an introduction and an update to Working Group 1 and the co-production protocol in CUPID. We look at individuals who will support the co-production protocol, meeting Working Group 1 deliverables as in the scoping review and the training school for 2024, and indeed the dissemination process to date. As Vladimir has already outlined, CUPID aims to improve cancer prevention understanding for people with intellectual and developmental disabilities in the European Union. And as we know, cancer diagnoses are often made after behavioural distress or physical presentations, leading to earlier deaths in this population, and as Vladimir referred to it as diagnostic overshadowing. Working Group 1 will collaborate with people with intellectual and developmental disabilities and indeed relevant stakeholders to develop a knowledge base about cancer prevention strategies for this population. In terms of co-production, the term co-production refers to a way of working together. And in the case of CUPID, it involves service organizations, users or people with intellectual disabilities and developmental disabilities, their families and significant others and carers in order to reach a collective outcome in relation to cancer prevention. This involves, as you can see on the diagram, teamwork and communication, information sharing. We also envisage that we'll try and have a shared vision and values, that it's equality for everybody, and the outcome is better cancer prevention strategies for people with developmental and intellectual disabilities. We have three main tasks in Working Group 1. The first task is to establish an international interdisciplinary group of stakeholders in all the COS countries participating in this project. I think we have 27 countries, possibly 28 or more. Task 2 looks at collaborating and sharing knowledge to better understand the obstacles and supports associated with cancer prevention in this population. And this will be achieved with the help of advocacy groups, caregivers, organizations, all adhering to the principles of patient involvement. And finally, our task 3 is to recommend what research and training would be best suited to customize cancer prevention programs to cater for the needs of people with developmental and intellectual disabilities. Now I will hand over to Dr. Oliwia Kowalczyk, my colleague, to continue the presentation. Oliwia, I will press as you go along, okay?
Yes, thank you very much, Dr. Denny. We can go on, yes, and let's look at the deliverables. Okay, right. So the main deliverable for our working group is to create a process for evaluating the inclusivity of cancer prevention initiatives for people with intellectual and developmental disabilities. Of a significance to us is the assurance that the offered screening programs are accessible to all our target group. And to ensure the effectiveness of our work, we will seek input from healthcare professionals, individuals with intellectual disabilities, their relatives, and other relevant stakeholders. If you could press the next one, please. So the one before. Yes, thank you. So Dr. Denny has already briefly introduced the concept of co-production, which is our main strategy. And to reach that important part of our work, we have managed to identify individuals who will support us in contacting service users organizations to determine the necessary structures and processes for co-producing CUPID protocol. And Dr. Suzanne Denny has supported us with invitation letters, which helps us to encourage the invited organizations to cooperate with us and join our efforts. To meet our deliverables for year one, we have organized 2 meetings in Poland. During them, we focused on discussing and agreeing on a protocol for co-production, conducting a scoping review on best practices related to co-production with people with intellectual and developmental disabilities. And we have also agreed on the scoping review framework and the scope of work to complete this part by the end of this month. We have also agreed on the details concerning our training school, which will take place in Slovenia in May next year. The key speakers and workshops have already been discussed and planned. We have also managed to contact main organizations closely related in their daily work with people with intellectual and developmental disabilities. We'd like to thank all those WG1 members who have helped us in this process. Thanks to their work and contribution, we have already have organizations from 15 countries already ready to join us and participate in our work. And as far as the dissemination part is concerned, in September, Dr. Margaret Denny presented at IPOS Oncology Conference in Milan. She also chaired the symposium on CUPID, during which all working group leaders, including myself, had a great pleasure to present on CUPID and cancer prevention. The added value of this symposium was the feedback we received from the IPOS participants, and which we will consider while developing the project's co-production protocol. And in my last part of this presentation, I would like to say that a significant progress has been made on the co-production protocol in CUPID in year one of our work. I would like to thank Professor John Wells, the main leader and the main initiator of the CUPID, but also to Dr. Suzanne Denny and Dr. Margaret Denny for their great contributions. And also I would like to thank all Working Group 1 members for their involvement and efforts to make our tasks effective and successful. And hopefully next year will be just the same successful as year number 1. Thank you very much.
Thank you very much, both of you, Dr. Denny and Dr. Kowalczyk, for your wonderful presentation, very comprehensive, and you show to the people who are outside from CUPID project, and we have a lot of participants outside of our CUPID membership to know better about the ideas of WG1. And you have tremendous work finished in this year, and also I'm a member and I can prove that, especially from the last meeting in Poland. Now we are going to the second presenter, Dr. Maarten Cuypers from Holland. He is the leader of the WG2 group, and he will present us the results and outcomes of the WG2 group in the first year. Please, Dr. Cuypers, go on.
Yes, thank you very much for this introduction, and I agree with all what I said before on your efforts in organizing this webinar. So I will present in the next, I hope I can do it within the next 10 minutes, about Working Group 2 in the CUPID project, which is targeted at the cancer prevention policies and audit and evaluation. I chair Working Group 2, and I do that in collaboration with Vladimir from Serbia. I just pulled together some slides. Some of them we used before in other presentations, but I thought it would be good just to explain a little bit about the definition for intellectual disability that we use in this project, and also in relation to the task of our working group in relation to the organization of public health and policies that we're reviewing. The intellectual disability, this is defined as people with significant limitations in cognitive functioning and adaptive behavior. It's originated before adulthood. The IQ threshold is usually set at 70 or 75, and around 1 to 3% of the population is usually affected by intellectual disability. It can differ between countries, whether depending on which definition you use, but also differences between countries. But it is important to take into account that when you look at the Organization of Public Health and policies that are in place, that the population of people with intellectual disability is actually different from the general population that you have in the country. So when we look at the entire cancer journey and also think of the organization of care and the public health policies that are active there, you can see throughout the entire cancer journey that there are several phases in which people with intellectual disability may encounter differences or barriers. Largely, they can be summarized into 3 areas. In the boxes here, it's screening and prevention, oncology care, which usually is in the hospital setting, and palliative care or survivorship, which usually is in the area of home care. And in this project, we focus in the first part, which is home to a public health policies and organization of public health in different countries. This is an image which is quite effective to explain why it's important to look at these policies. If we look at organization of public health throughout Europe at the European level, but also in each country independently, you see that many systems and policies are aiming to have equal policies and equal access to health for everybody. But as I explained, we identified a population, people with intellectual disabilities, that may experience barriers and require some adjustments to acquire the same level of care and the same chances of good outcome. So we're more focusing on whether all the organization of care is equitable and whether it is even justice. So in many areas, we see that policies will likely aim for equality. And in this project, we also look at if they are equitable and justice. Already also some bit was in the previous presentation, there is some evidence that people with intellectual disabilities face barriers, in particular in the area of early detection and screening of cancer. So low participation in cancer screening programs, cancer diagnosis being made at a late stage, which also affects their possibilities of successful treatment. Here are just a few papers that state something about that. If we then look at the tasks that are defined for our working group 2, they're all focused around an evaluation of the policies that are out there at the European level, but also in each individual country. There are 4 tasks defined. The first one is more broadly around exchanging knowledge in this theme, and particularly around the functioning of health systems. Our second task is to agree, create, and conduct an audit and evaluation of health systems. And the third task is actually related to that, to see whether how they address the needs of people with intellectual disabilities. And our fourth task comes forward from these previous tasks and is to identify which improvements are needed to make sure cancer screening and prevention is actually equitable for people with intellectual disabilities. So the progress of our working group in the past year, we had our working group meetings. We spent quite some time on development of the search protocol to actually conduct the evaluation of policies in different countries. We tested the protocol, and I will show some more details on that later. We also had some conference presentations. We completed one short-term scientific mission, and we had a scientific publication, and I will explain some of these points on the further slides. So we had 6 online meetings. We had 1 live meeting. Work of our working group was presented at the WONCA conference in Brussels. It's the scientific conference for general practitioners, who of course have an important role in organization of screening and early detection of cancer. And also at the IPOS conference in Milan, we were present. We had 1 completed short-term scientific mission, which was an exchange between Serbia and Turkey. And as explained, a large part of our task was on the development of protocol to search and evaluate all the policies that are out there across Europe. And we've published one article that actually summarizes our main task and why we are doing this project. And I will show the link later on. So the policy search and review, we aim to systematically identify and review policies on cancer screening and prevention across Europe and assess to what extent they address people with intellectual disabilities. Preferably, we aim to get insight in that across the entire continent of Europe, not just the 27 member countries of the European Union. And we use both the scientific and regular web databases to identify relevant sources for that. So what is actually an important part of it is that if we ask people from different countries to search and evaluate their policies, that they also use the same search strategies. So this is the one that we identify that has some component on searching for the different definitions regarding intellectual disabilities. There's a search term in there related to cancer, a search term that identify all the policy documents, guidelines, government documents, all the keywords that are related to that. And the final search term makes it specific to one country. You can imagine that all the English speaking countries, if you run this search, they also come up with search results that are not specific to that country. For example, in the UK and Ireland, they are likely to find results written in English, but not all of them are relevant to both countries. And in this case, this example is from Serbia. We also had it translated that it can actually be searched in the national language. So how then does results look like? This is the one from Ireland, and it's actually the results for each step in the previous search strategy. What is most relevant is in the lowest bar is that if all search terms are combined, it results in 26 documents to review, and I believe in this case none of them were actually relevant for the search query that we had. So you also have to rely on additional search by hand that we know from people who have knowledge of the organization of care in their own country, that they know where to look for, even if it doesn't come up in a search like this. So how do we continue with this task in the next year? So we are right at the stage of finalizing the search protocol. We're actually at the stage of completing it and also have it available to share within the CUPID network. So we will identify representatives per country and invite them personally to ask them or ask others to conduct a search for their country. And then we collect all the findings from all these different countries, evaluate where there are overlap, where there are differences, and report on that. And it is actually also one of the main tasks in terms of outcomes of this working group. And just to close off this presentation with actually nice results recently, it's published last week. It's a paper from our working group, some of our working group members, that we took time to actually write down why we are conducting this task within working group 2. So a bit more background information about the setting and the relevance of this project. So if you like more information, please look up this article. It explains it very well. And I think with that, I'm at the last slide. Thank you.
You are muted, Vladimir.
Okay, sorry, I have some troubles with internet. I didn't see when Dr. Cuypers ended, probably 1 minute my internet connection today is very bad. Sorry for that. Now I would like to thank. I saw the most 99% of his presentation. It was very interesting, and I know that he and Dr. Vladimir Vukovic from Serbia, who is the vice chair of the WG second group, is very serious workers. And in my presentation, you will see one more achievement. I'm not aware did he mention the article, but in my presentation of WG4 group about dissemination, I will say a few words about this. Now, I will ask Dr. Vera Dimitrievska from Macedonia. She is the vice chair of WG3 group. Dr. Peter Knapp was excused himself because he has a lot of obligations for today, and the vice chair of this group will present in next 10 minutes the outcomes and the results of the working group 3 in the first year. Please, Dr. Dimitrievska, go on.
Thank you, Vladimir, Professor Trajkovski, about the introduction, and I'm really glad that I'm part of this event. And I'm really surprised positively about the interest for this annual conference. You have done a lot in terms of the visibility, especially in North Macedonia. I've seen a lot of people that have registered to listen this annual conference for cancer and disabilities. As Vladimir mentioned, I'm Dr. Vera Dimitrievska, Deputy Working Group Lead for the third group of this CUPID project, along with Peter Knapp and Dr. Kate Sykes, who is on a maternity leave, and Peter is temporarily replacing her. So I will present shortly objectives and the key activities of this working group. And then after me, Dr. Mairead will continue with the activity of the working group 3 that has been actually part of this year activities foreseen for this project. Oh, sorry. So this working group is trying to combine the outcomes of the previous two groups, working group 1 and working group 2, into one research agenda for universal EU cancer prevention guideline for people with intellectual disabilities. And this development could be achieved by improving the overall health of people with intellectual disability, taking into account the European Code of Cancer, and to ensure all people with intellectual disabilities have the same right to access cancer screening programs, and their unique needs are taken into account in care provision, including economic and literacy requirements. The main specific objectives of this working group 3 is to exchange knowledge and experiences in order to develop the research agenda, as I mentioned, to design the guidelines for a maximum standard of equitable access to cancer prevention initiatives and screening programs implementation beyond the CUPID project. And the second specific objective is to generate a research agenda to develop guidelines for different health providers on the knowledge, skills, competencies needed to meet standard of care requirements and appropriate service evaluation. What has been achieved so far in the last first year of the project implementation? We have increased the number of membership. So far, around 70 members are part of the working group 3, including from the underrepresented member states, early career researchers, and nations where less research is currently undertaken. Also, as part of this working group 3, we had organized 2 main events, 2 workshops on equality in cancer. One was in Dublin at the Trinity College. It was online on 25th of April in 2023. were brought all together stakeholders and working group members from Ireland especially to explore the inequalities in cancer prevention, treatment and management of people with intellectual disabilities in Ireland. But those who were not they had the opportunity to follow it online. The workshop used the social determinants of health model to explore the inequalities among people with disabilities. And the second, about these details of this workshop, actually, Margaret will speak a lot and will present the findings of this workshop after me. The second one was on cancer prevention in people with disabilities. It was held in Ankara, Turkey in May. It was a 3-event workshop where the first day were brought together stakeholders and working group 3 members from Turkey. Also, we had the opportunity to follow it online on the last day to explore the inequalities in cancer prevention, treatment, and management of people with intellectual disability in Turkey especially. And the workshop also used the social determinants of health model to explore the inequalities. The day 3 work consolidated all the findings of the discussions and made place for the next year. Based on that of these 2 workshops, actually, currently we are preparing and drafting the paper of the 2 workshops for peer-reviewed journal, which is underway. And the working title would be towards developing a universal EU cancer prevention methodology in people with intellectual disabilities, findings from the CUPID Dublin and Ankara workshops. So these were the main activities. It looks like that are kind of small numbers of activities, but it took a lot of time to be organized and to be developed and to implemented them through the whole period of the CUPID project last year. I mean, the year before, in 2003. So I give Vladimir my word to Maria to continue the findings. This is just a short overview of the working group 3 goals and activities that we have achieved so far, implemented so far.
Yeah, I will tell. Yes, thank you so much. It's a productive work from WG3 group. I would say that it's enough for the job for 1 year. You did a great job. So also because we are from the same country, I know that you are preparing a good article, and I hope that you will share the results on the next annual conference at the end of the 2nd year, next year in November. So I ask Dr. Mairead O Connor. She's a member of WG3 group and also WG4 group, but now she will present. Please, Dr. O'Connor, share your screen. She will talk about understanding cancer prevention among people with intellectual disabilities in Ireland. And I hope you will enjoy in this presentation. Please go on.
Okay. Hi, everyone, and thanks, Vladimir, for giving me a chance to talk today on this important topic. So I'm just going to talk a little bit about cancer prevention research among people with intellectual disabilities in Ireland and what we know about it. Sorry. Okay, so I'm not going to talk too much about health inequalities. We all know about the inequalities that people with intellectual disabilities face in terms of their mortality, their morbidity, their healthcare access, healthcare utilization, and health surveillance, health literacy, and diagnostic overshadowing, which was covered earlier. And then in terms of cancer and intellectual disabilities, specifically health inequalities, patterns of cancer and cancer mortality are well documented in the general population, but not in people with intellectual disabilities, and there's poor evidence base. But there's a lack of descriptive epidemiological evidence base, but evidence is emerging to signal towards people with intellectual disability 1.6 times more likely to get cancer, 1.5 times more likely to die from cancer, and in some cases 45% of cancers are diagnosed late stage. So just in terms of HPV vaccination, which is a cancer prevention strategy for HPV-associated cancers, HPV-associated cancers account for 5% of cancers worldwide. So it's not a huge amount, of cancers, but in terms of cancer prevention, HPV vaccination is important. And we know from other jurisdictions in the UK and in Australia that vaccine uptakes are lower among people with intellectual disabilities, and specifically HPV vaccine uptake is lower among people with intellectual disabilities, or children with intellectual disabilities. And Maarten touched on cancer screening earlier. We know that cancer screening participation across the 3 cancer screening types, colorectal, breast and cervical, the ones that are screened for in Ireland anyway, is historically lower among people with intellectual disabilities. So these 2 studies are nice studies from recent studies, one from Denmark on breast cancer screening among women with intellectual disabilities, and they found markedly low participation rates in women with intellectual disabilities. And another nice study from Sweden that looked at invasive cervical cancer and cervical screening participation among women with a range of different conditions, and women with intellectual disability had the lowest participation rates in cervical screening compared to with the other conditions. So cancer screening in Ireland, we don't know a lot about cancer screening participation among people with intellectual disabilities. Older studies have signalled towards reduced participation, but these are from the early 2010s, and it's only 2 small studies. The same studies that I'm talking about signal towards poor awareness about breast cancer warning signs, risk factors, and breast cancer among women with mild to moderate disabilities. But I'm delighted to say that as I'm a research officer with the National Screening Service in Ireland, which covers the 3 cancer screening programs, and we are just about to launch a new equity framework for cancer screening. And within the remit of this, one of our priority areas going forward will be increasing participation in underscreened groups. And one of the underscreened groups is people with intellectual disabilities. So I suppose watch this space. It's not actually published yet, but I'll keep you updated. Just on to research, I suppose the research landscape in Ireland in terms of intellectual disabilities and health. Trinity College Dublin are doing fantastic work at the moment on intellectual disability and health. There's a study called TILDA, which is the Irish Longitudinal Study on Aging, and there is an intellectual disability arm of this study, and they've been collecting data since 2011 on people aged 40 plus with intellectual disabilities in Ireland. And following on from this, I was delighted to see this protocol published last week or the week before, I think, by Dr. Martin McMahon, who is part of Working Group 2 and Working Group 1, I think, and Working Group 3. So this protocol is going to be part of the CANDID study, which aims to explore cancer incidence, prevalence, diagnosis, treatment, and factors associated with intellectual disabilities in Ireland. This study will use data from the IDS TILDA study that I mentioned. So that's definitely a positive step forward towards understanding cancer in Ireland. And just in terms of research funding in Ireland, our biggest national cancer society, the Irish Cancer Society, is their largest cancer society in Ireland. They recently launched a funding call specifically for underscreened communities. And one of these groups was people with intellectual disability. And this is the first time that they've had such a call, which is positive. So just very briefly, I'm going to talk about the Working Group 3 findings from the workshop that Vera touched on earlier. So the workshop aimed to identify key issues affecting prevention, diagnosis and management of people with cancer who have intellectual disabilities to inform and make recommendations for policy and practice. So we held the workshop in April and the Turkish workshop was held in May. We used the World Cafe approach, which is an informal way of gathering data from people. And we brought together 18 key stakeholders across the spectrum, from cancer organisations in Ireland, health professionals, policymakers, academics, and people working with people with intellectual disabilities. And we, as Vera touched on earlier, we looked at the social determinants of health. So we had 3 tables and people rotated between the tables, and issues were discussed under the remit of the social determinants of health, which are personal characteristics, social and community factors, general socio-economic, cultural and environmental conditions. And just very briefly, the overall themes from the Irish workshop. Some of the themes that came up were the influential role of family on access to prevention services. Relationships with primary healthcare providers were hugely important. The lack of education and awareness among people and with intellectual disabilities and their carers. The serious dearth of information and training among health professionals on how to handle people with intellectual disabilities. A general lack of research, a lack of data, a lack of policies and lack of coordination across services who are caring for people with intellectual disabilities. One of the overarching themes from our workshop in Ireland was nothing about us without us, which means basically that people with intellectual disabilities need to be empowered to where they can, when they can, to look after their own health, give them the tools and the education and information to make decisions about their health where possible. So these are just some key items that we recommended, or that key items that we, I suppose, recommended from the workshop. And this includes research is required, high quality data on cancer incidence is required, more focus needs to be given to providing appropriate educational material to people with intellectual disabilities, reasonable accommodations need to be made for hospital or GP appointments, increased training for health professionals, a national database of resources for health professionals and researchers working with people with intellectual disabilities on cancer prevention, and a more collaborative approach across services offered to people with intellectual disabilities. So that's my talk, and thank you for listening.
Yeah, thank you very much, Dr. Connor, for your very useful and practical presentation. I can say that Ireland and UK, Netherlands are real leaders in this field, and the Southeast Technological University, the grant holder, it's a real leader in this project, and we can learn from all of you here on the Southeast European countries, for example. Now I will give floor for myself. Let me share my presentation. I'm the leader of Working Group 4, where the vice chair is Dr. Mairead O Connor, but she's probably more active in the Working Group 3 for now. We'll see in the future. On this slide, you can see our first meeting in life, a small group of participants, 15th of March in Brussels, but very effective group of colleagues. This was in the office of the ESPD. Then I will not talk so much about the main principles of the CUPID project, because I mentioned before on the opening ceremony. We have around 35 members, and I would like to thank to all of them, to more active and to more passive members. You can see all of them here on this slide, but I will not read all of them because I have only 10 minutes for this presentation. The objectives, the main objectives are that we are, as a group, responsible for dissemination of the action and activities and deliverables to website, social media platforms such as Facebook, Twitter, LinkedIn, Instagram, blogs. And for those who are outside of the CUPID action, I share some of them, and my editorial assistant Andrea also will share some other during my speech, some other Instagram, for example, and the YouTube channel, and you can visit all our activities during this year and in the following 3 years until the end of this project. I will not read the task. All of them are on our website. We already created, and I will show you the website on the following slides. Also, we recruit cost action members to participate in the conference, and my idea for organizing this conference was that to disseminate the results, and also I want in the next years I will try to do my best to share on the next or the second, third year, and also probably we will have in life at the end the huge conference at the end of the project where we will share all our results of the project at the end of the project. We organize webinars, providing updates, information, etc. Also, we are guesting on the mass media, TV, TV media, some portals. So that's one of our tasks and deliverables. I'm going now to share some deliverables of WG4 group to organize open access webinars and conferences such as this one. Also, additionally, future prospects to the knowledge developed during the CUPID action also will be discussed on our meetings. Our next meeting of the WG4 group will be in Copenhagen in March 2024. So I hope that we will have a great job there. What were our activities in the first year? We organized 3 online meetings where the budget for 2023 was established, designed official project logo, nominate for establishing website IT company from Macedonia. I am responsible for the social media also, and I would like to thank all of these participants, and also Andrea Ivanovska, who also contribute in design of project logo and some leaflets and pamphlet posters of this project. We organized meeting in Brussels and making contacts to arrange a meeting with MPs. This is the official logo of the CUPID. You already saw it. The first article was from the Professor John Wells, published in the Journal of Health and Rehabilitation Sciences, and it has a very huge number of abstract views. It's now more than 1,000 and PDF downloads. It's about cost action and challenges facing people with intellectual disabilities and across the Europe. And it introduced the CUPID Cancer Project. So one of the project dissemination group is the preparing articles. The second one was from the team Katarzyna Cwirkalo and Agnieszka Zita from Poland. It's Polish and on a Polish language. And the third one, here you can see the authors, and the main author Vladimir Vukovic and Maarten Cuypers from the WG2 group. The importance of cancer prevention policies to inform and guide prevention and screening measures for people with intellectual disabilities, published in Journal of Intellectual Disabilities. This is impact factor journal with 1.5 impact factor, and it was published a week ago. So I hope that the production of scientific articles will enlarge in the following years. This is one of the posters which was created by our team here in Macedonia. We are very active on Facebook. Please join us. This is the main page on Facebook. This is the profile on LinkedIn. Then this is also CUPID on Twitter for those who are active on the Twitter or X. They are rebranded. Then Cupid on Instagram, we share photos from our events, and also from today's conference, we will share some photos as a part of the dissemination and communication with the broader community. Here is the main page of the Cupid website. I share it, and also the visitors from which countries they are coming. The statistics, we have more than 2,300 since March this year, when the Cupid website was established, and we are preparing on a daily basis, I would say, updates. When the activities from the other groups come to me, immediately I ask the IT company, and the activities are visible on our website. This is the brochure in PDF on 10 pages, which you can find on our website. I hope that Andrea will share with you. Also some leaflets, banners. Also, I prepared a communication plan, and it was shared with all Cupid members 2 weeks ago, and you can find it also on our website. I prepared guidelines for virtual and hybrid meetings, and I'm waiting approval from colleagues from CETU, and I hope that it will appear very soon, these guidelines. I hope that you will use it in your organizing future virtual and hybrid meetings. Also, I prepared the dissemination activities tracker, where all working group leaders and vice chairs should put their activities, and at the end of the year should give to the leaders of the project to make better the final report or annual report. There is the publication tracker table, events tracker, and all of leaders of the groups already shared with us their events, and you already saw them in their presentation. Next steps, which working group 4 should do: making the Cupid website on a daily or week level, growing members of social media accounts, publishing text, posters, and social media, publishing text about Cupid in newspapers, organizing. I didn't change this. We planned firstly in organizing Maribor, but we 1 week ago we changed the place. Our meeting will be together with MC meeting in Copenhagen in March. So this is, sorry for a little mistake. Guesting interviews about Cupid on radio and TV, broadcasting programs in all country members. We already create a YouTube account a week ago. Creating easy readable Cupid brochure for people with intellectual disabilities. That's our next step. Organizing next annual conference November 2024, and sending Cupid info to member of European parliaments by email, and if possible to meet some of them in Brussels. This is for the 2024 the budget, but it's not so important for especially for outside people who are outside from Cupid. And this is our Ohrid Lake, Ohrid town, very ancient town, one of the ancient lakes in the ancient lakes, the second after the Baikal lake in Russia. Ohrid Lake is one of the oldest lakes and deepest lake in the Europe. So probably in the next 3 years, one of the meetings will be in Ohrid. Thank you very much for your attention. And now I'm going to open the session, questions and discussions, if there are some. As I saw, some of you can join us with camera and with audio, or if you don't like that, you can post your question or comment in the Q&A session. We are still not at the end. At the end, I want to gratitude to many people, but now I am opening. Is there someone who wants to say something which we don't say in our presentation from CETU, or is it there someone from the participants who are not familiar with CUPID project? And we have probably around 50% of today's participants, because I have opportunity to see the participants list. Around 50% are not CUPID members, and they are not so familiar with our activities. I cannot see, there are 5 questions. Dr. Tim Pell, can the key findings as presented be shared? To whom is your question, Tim?
Yeah, pardon me. So for the I did also do a second question, which was, can the key findings as presented by Ms. O'Connor be shared? Her last slide was about a key findings table, and my question is if those findings and perhaps other findings can be shared with CUPID members.
Mairead?
Yeah, certainly, yeah, I can definitely share the presentation. We will be writing that up for publication, as Vera had said earlier, the key items that are presented in that last slide, but I can certainly share the presentation with you. And our workshop report as well, if you want.
Perfect.
Dr. Tim Pell asked me to explain my presence on one of the most popular Macedonian national television. It's Channel 5. It was 3 days ago. It was a short interview for 2 minutes and a half. I'm sorry, it's on a Macedonian without translation. I don't know, do we have opportunity to translate it on English? The journalist was interested in this project, and she asked me to tell to the Macedonian audience about the main principles of CUPID project, our activities. Also, she was interested how is the situation in Macedonia, and it is not so pink in the field of intellectual disability and cancer prevention. And finally, I announced this conference to Macedonian people. That's the answer of the third. Now I'm going, most of the questions are from the team. Participants can share a short biography with, you can see, I hope that all of the participants can see his email, and example about health idea. And it is a good idea. Some of us already shared our short biography, and thank you, Dr. Pell, for this announcement. By doing so, people from within COST are able to find you and find your expertise. Hopefully, this enhances knowledge exchange across WGs and countries. Okay. Irena Stojanovska from Macedonia, she's my Master of Science. To Dr. Denny or Dr. Cuypers, it's a question. Do you have any initial results on the extent of differences between countries across Europe in terms of cancer prevention, treatment, and mortality rates in persons with ID? Dr. Denny?
Yeah, we're presently undertaking a scoping review, and we hope to have some results by January 2024. So I'll pass on to Maarten. Perhaps Maarten has more?
No, I'm afraid.
Maarten, please.
Yeah, no, I'm afraid not. We're currently finalizing the search protocol, so we're aiming to start next year in all the different countries that they can search for which protocols and guidelines are out there and how they facilitate people with intellectual disabilities. We don't have results yet, and treatment and mortality rates are, for us at least, out of our scope of our research. So we will focus on the policies regarding cancer prevention and screening mainly, and more broadly also the organization of public health. Treatment and mortality is out of that scope.
Yeah. I hope that the colleague will be satisfied with your answers. Are there any other comments, discussions, questions from the audience? I can say that we have the maximum, which I saw 95 participants together with us, with speakers, and I'm really satisfied with this number. There were around 109 9 participants registered, but I'm aware that not all of them are presented on the conferences. So I saw through the chat, and there are your names and your emails, which will help to Madame François Haiki to prepare the certificates with names and with and as soon as she finished this job, I know her that she will send to all of you on the time, and I will spread with the speakers after this conference the certificates. So we have, if there are no, I'm looking to the Q&A session, there are no other comments or questions. Most of them are from the team PEL and one from Irena Stoyanovska. No additional comments or questions from representatives from the grant holder. So if you let me, I can say a few words. We are on time, and also I'm glad for that, because all speakers were on time. The time was around 10 minutes plus minus 1 minute. And now let me to say thank you first to Dr. Susan Denny, who is she's communication officer of the CUPID project, and now replace Professor John Wells, to Mr. Florian Scheiben, sorry for pronunciation if I not pronouncing so well, and to Madame François Haiki for the technical support and all support they give in last 1 month since I decided to organize this annual web conference, and especially to Professor John Wells, who cannot join us today. Also, I would like to thank to my collaborators, Andrea Ivanovska and Irena Stoyanovska, and to express my gratitude for their work in last year. And also I want to thank all of the speakers, to Dr. Denny, Dr. Kowalczyk, Dr. Cuypers, Dr. Dimitrievska, and Dr. O'Connor, who make this conference very fruitful and very informative for all of you. I will attend to this annual conference to be, as I said before, to be each year at the end of the year, where we can share with all of you, with CUPID members and with the broader audience, our results. And I hope that it is in the we will fulfill the idea of European Commission about the open science. That's our one of our main ideas. So also thank you very much to all people who join us now on this meeting and spend 1 hour and 10 minutes together with us. So as I said, you will get your deserved certifications. you can follow us on our website, our activities on the social media, and we will be much better in the next year when we will organize the second annual conference. So take your health safe and be healthy, and hope to see you. I talk to CUPID members in person. We have for 30 places 15 CUPID MC members and 15 WG4 members on Copenhagen. I hope that before that we will have no opportunity to see each other, but if there is need in December, we will organize one more MC meeting, and we'll talk about the plans for 2024. Okay, I will not speak anymore. Betu Tosun asked to let us take a screenshot. Yes, you can do it, a screenshot. All of you can. My team and me, we also made photos, print screens, and you can see them after this conference on the social media and some of them on the website. And I will do that as soon as possible, probably today, later today. So you can see, but also you can, there are two pages now, 2 pages with your screens, 1 and 2. Please make print screens from 2 pages. Around 4, 8. I hope that Francois will have in the Zoom all your names which were mentioned in the chat. Some of you twice wrote your names, but I hope that if there are some, if someone of you will be missed, please write me email. But the condition was to be during the whole webinar, from the first minute until now. Because I know I have experience from some webinars, you're coming on 5-10 minutes and you want to take a certification. It's not fair. Okay. I hope that you already made your print screens, and now it's really time to say goodbye. I'm very glad to see all of you here on this meeting, and see you on another occasion, and follow our activities, our YouTube channel, and all our social media and website, and you will see our outcomes and the results. Goodbye. See you.
Bye, everyone.
Thank you.